Okay, so today we're going to talk about a piece of paperwork that honestly seems pretty boring on the surface. But as you're about to find out, this one single document can literally be the difference between a smooth recovery and a really dangerous medical error. So let's just jump right in with a question that gets to the heart of all this.
So, let me ask you, when do you think is the most dangerous moment of a hospital stay? Is it, during some complex surgery? Or maybe in the middle of an emergency procedure? Well, the answer is probably not what you're thinking. It's often not when you're surrounded by all the specialists and high-tech gear, but at the exact moment you walk out the door.
Yeah, you heard that right. That moment of discharge is what a lot of people in medicine call a dangerous handoff. It's this incredibly critical point in time where you, the patient, are moving from one team of caregivers to a totally different one, from the hospital staff back to your family doctor, or maybe other specialists, or even just back to yourself and your family.
And the reason this moment is so risky? It all comes down to one word: communication. Just think about it for a second. Hospitals are high-pressure places, doctors are often overworked, different computer systems don't talk to each other, and there's just a mountain of information that needs to get transferred. So when the details of your stay, the diagnosis, the treatments, the medications, the plan for what's next, when that stuff doesn't get passed along clearly, things can go wrong, fast. These communication breakdowns are a huge cause of medical errors that could have been prevented.
But the good news is there is a tool that was specifically designed to stop this from happening. It's kind of the hero of our story today, and it acts as a critical information bridge, and I'm talking about the discharge summary.
So what is this thing exactly? Well, a discharge summary is the official medical document that lays out everything that happened during a patient's time in the hospital. You can think of it as the ultimate handoff document. It's that bridge connecting the super intensive care of the hospital with all the ongoing care you need out in the real world. Its entire job is to make sure that transition is seamless and, most importantly, safe.
And when you look at its core mission, you really start to get it. This isn't just some note in a file. Its job is to actively prevent errors, to make sure you actually get to your follow-up appointments, to ensure everyone involved is on the same page about your health, and to clearly explain what was done in the hospital and what you need to do next. It's doing a lot of heavy lifting here.
Okay, so for this document to actually work, it has to be put together just right. A great summary isn't just a random jumble of medical facts. It's a carefully told story. So let's take a look at the anatomy of what makes one really effective. It really all comes down to these four pillars. First up, patient information. Sounds super basic, right? Who is this about? But you would not believe how easily this gets messed up, and the consequences can be huge. Second, the hospital course. This needs to be a clear, short story of what happened, not just a confusing list of events. Third, treatments and response. This is where the doctors explain what they did, why they did it, and how you reacted. And finally, and this is so important, clear, actionable follow-up instructions. This is your roadmap to getting better. If you miss any one of these pillars, that bridge we talked about starts to get real shaky.
But here's where it gets even more complex. A really great discharge summary has to somehow speak to completely different audiences at the same time. This is where writing one goes from being a task to a genuine communication art form.
And this right here just illustrates the challenge perfectly. On one side, you have the next doctor on the case, who needs all the precise medical jargon and complex data to make good decisions. But on the other side, you've got the patient and their family, who need a summary they can actually understand, with simple language and crystal clear instructions. A great summary manages to do both of those things at once.
So, as we start to wrap things up, I really hope it's crystal clear that we're not just talking about some administrative paperwork here. This document is a genuine cornerstone of modern patient care.
And here's the bottom line. For anyone in the medical field, getting good at writing an effective discharge summary isn't just about ticking a box. It's a fundamental act of patient care. It's all about keeping patients safe and helping them get the best possible health outcomes once they leave the hospital.
I think this quote just says it all. The discharge summary isn't an afterthought. It is the final, crucial act of care a hospital team gives to a patient. It is the last and maybe the most important step in making sure that patient has a safe journey back to health.
So, I'll leave you with the same question we started with. Now that you see the critical role it plays, how it bridges all these gaps in our healthcare system, what do you think? Is the discharge summary the most important medical document you'd never heard of?